ಮನೆಯಲ್ಲಿ ನೀರು ಹಾಕಿದ್ರು ಕಾಂಪೌಂಡಲ್ಲಿ. ಸೊ ಅದು ನಾನು ಹೊರಗಡೆ ಬಂದಾಗ ಎಲ್ಲ ಕ್ಲೀನ್ ಮಾಡಿದರು. ಸುಮ್ಮನೆ ಏನೋ ಒಂದು ಬಿದ್ದಿತ್ತು, ಅದನ್ನು ತೆಗಿಯೋಣ ಅಂತ ಹೋದೆ ಅಷ್ಟೇ. ಅದು ಜಾರಿ ಬಿದ್ದುಬಿಟ್ಟೆ. ಬಿದ್ದಾಗ ಇಲ್ಲಿ ಪೈನ್ ಆಯಿತು. ಸೊ ಹೋಗುತ್ತಲ್ಲ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಆಮೇಲೆ ಪೈನ್ ಕಿಲ್ಲರ್ ತೊಗೊಂಡೆ ಒಂದು 3-4 ಡೇಸು. ಅವಾಗೇನು ಅನ್ನಿಸ್ಲಿಲ್ಲ. 4-5 ಡೇಸ್ ಆದಮೇಲೆ ಮಾರ್ನಿಂಗ್ ಮತ್ತು ವಾಕ್ ಹೊರಟವನು ಜಸ್ಟ್ ನಮ್ಮ ಮನೆ ದಾಟಿ ಒಂದು 4-5 ಬಿಲ್ಡಿಂಗ್ಸ್ ಇರಬೇಕು, ಬಂದಲ್ಲಿ ಕಾಲು ಇದಾಗಲೇ ಇಲ್ಲ, ಆಕ್ಟಿವ್ ಆಗಲೇ ಹಂಗೆ ಅಳ್ಳಾಡ್ಬಿಡ್ತು ಕಾಲು.
We noticed that he was not able to walk 3-4 days after he fell. So doctor suggested an X-ray, and there was a fracture where they said that you have to do hip replacement surgery. So once the doctor explained the process of the surgery to us, and he said he can walk again because he is a very active person.
ಬೆಂಗಳೂರು ಹಾಸ್ಪಿಟ್ಲಿಗೆ ರೆಕಮೆಂಡ್ ಮಾಡಿದರು, ಅಲ್ಲಿ ಆಪ್ರೇಷನ್ ಆಯಿತು.
Hip fractures by and large are treated surgically. Since he was quite active before the injury and he was walking for at least an hour every day, we felt that total hip replacement would be the best option for him. He tolerated the procedure well, and as per protocol he was made to walk using a walker on the same day, and overall recovery was smooth.
ಆಪ್ರೇಷನ್ ಆದಮೇಲೆ ನೋವೇನು ಬರಲಿಲ್ಲ. 3 ಡೇಸ್ ಆದಮೇಲೆ ವಾಕಿಂಗ್ ಸ್ಟಿಕ್ಕಲ್ಲಿ ಓಡಾಡಿಸಿದ್ವಿ. ಆಮೇಲೆ ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ ರೆಕಮೆಂಡ್ ಮಾಡಿದರು, ಸೊ ಅದು ಮಾಡಿಸ್ಕೊತಾ ಇದ್ವಿ.
I feel the recovery was quick. He was able to walk. Now almost 2-3 months later, he is almost back to normal. He is walking, however he was walking before, like almost 1.5 hours in the morning. We are happy with his recovery.
Today is World Osteoporosis Day, hence we would like to highlight on one of the important consequences of osteoporosis, which is hip fractures. Let's go to a few common questions that people have on hip fractures. Hip fractures generally occur in the elderly population, and it is a fairly serious problem. After a hip fracture, the patient is unable to walk, and this generally leads to other complications like infections, blood clots, heart attacks. So it's quite important to identify hip fractures early, and it is a very serious condition. Hip fractures are generally seen in elderly patients due to slipping and falling on the floor or falling from the bed. To prevent hip fractures, I would recommend leading an active lifestyle, having supplements which have calcium and vitamin D, taking treatment for osteoporosis, and also changing some facilities inside the house, like adding railings in the bathrooms and also using anti-slip mats. These can avoid and reduce the chances of having hip fractures. Once a person has a hip fracture, he or she would have severe pain around the hip, which means pain in the groin, pain on the side of the hip, or pain in the buttocks. Patients are almost always unable to walk. Even if they are able to walk, they would notice some pain. So these would be the main symptoms of hip fractures, and almost always it follows a trivial injury. The mainstay of treatment of hip fractures is surgical treatment. We recommend that the surgery is done at the earliest possible time after stabilization of the patient. Some fractures can be fixed with nails or plates, and in suitable candidates, partial or hip replacement is the treatment of choice.